All right, it's time for our Kegel exercises, Twila.
Yes, it is.
And so why do we do our Kegels? Well, it's important for our pelvic health for both men and women. These exercises help support our pelvic organs in women, the bladder, the vagina, the rectum, the urethra. And for some people, it can actually improve sexual functioning. Some people say it makes orgasms more intense and more frequent.
Well, I think that's a good enough reason to do them right
Nobody's going to
there.
argue with that, I don't think. So let's go ahead and do it.
Okay. 3
times a day.
6
Days a week.
9
Seconds per Kegel.
and 12.
Kegels in a row to make a rep. It's so easy. Just do 12 of these 3 times a day. When you're doing them, hold it for 9 seconds. You will be the envy of your neighborhood. You will have a pelvic floor like a chain link fence, so you will be able to pull a trailer.
If you so choose. And don't forget, you can always go to the GynoCast Facebook page and get an infographic, which kind of details out the customizable plan. You can print it out, put it on your fridge. You can put it up in your office. We can share it with your friends. And it's a great resource to have. So
Indeed.
Make sure that you go and do your exercises today.
Yes.
Stay tuned.
Welcome, everyone, back to the GynoCast. It's so nice to have you all listening. Twila, it's nice to see you again.
Thank you. It's nice to see you, too.
My name is Dr. Eric Heegaard. I'm a board-certified gynecologist, and this is our podcast.
Yes, it is.
We talk about the stuff that everybody wants to talk about, but sometimes doesn't know where to go. Well,
That's
you go here.
true.
You go here.
I like that.
That's right. And who are you, by the way?
Oh, I'm Twila Dang. I push the buttons, and I'm the mouthy girl with opinions. So
Push my buttons.
I try my best. I try my best.
So today we are going to, let's just jump into it, shall we?
You're feisty today. All right.
Let's just jump into this. We are talking sexually transmitted infections.
Okay.
Now, I'm going to ask people who have just tuned in to this show that we have a whole other show that we did
Not too long ago,
where we talked about the more common other more common sexually transmitted infections: gonorrhea, chlamydia, herpes, and syphilis. And what was the other one, Dr. Stecker? Because you were a guest on that one. Trichomonas.
Trichomonas, yep. There you go.
And so we're going to talk today about human papillomavirus. And I thought this was worthy of a single show in and of itself because, Twila, what do you think is the most common sexually transmitted infection, especially in the United States and probably worldwide?
HPV.
You got it. Human papillomavirus. And now, how many people in the United States do you think have human papillomavirus?
I'm not guessing that number because I'm sure it's wildly inaccurate in my head.
Well, let me ask you this. How many people live in the United States?
300 million.
That's right. We just talked about that.
Yeah, I'm cheating now. I've cheated.
There
I
are
already
about
knew that.
80 million people with human papillomavirus.
Really?
80 million.
Really?
Yes.
That's, wow.
And per year, there's 14 million new infections of human papillomavirus every year.
That's terrifying.
Right. And so why do we care? Well, it basically comes down to pretty much everything else we talk about. Number one, does it cause discomfort? Usually not. But does it have long-term ramifications in terms of a person's health? And so that's where it really comes down to. But we are talking about a virus that affects a lot of people. And so Dr. Stecker was kind enough to join us again. Dr. Stecker is a board-certified gynecologist here at OB/GYN West and is a...
you should tell us Dr. Stecker's full name.
Dr. Kelly Ann?
No.
I thought Ann was...
I'm sorry. I wasn't trying to put your middle name on blast or anything.
That was just a shot in the dark. I just thought to myself...
It's Christine. So it's...
Kelly Christine?
Yeah, Kelly Christine.
Kelly Christine. That sounds like somebody who should be a...
okay.
There you go.
A character on the Kardashians.
I already got myself in trouble once today. Not doing it again.
What are you doing today? Oh, we're having lunch with Kelly Christine.
Well, hey, if it works.
Yeah, the alliteration is there. That's for sure.
So Kelly Christine Stecker, I've known you for quite a while now. I did not realize that was your middle name.
Yeah, it's okay.
I'm sorry. I feel like I started this. I should have just let him start it.
Whatever.
KKS. And so Dr. Stecker is a board-certified gynecologist, which is a big deal. It takes a lot of training to be a gynecologist, and even more to be board-certified.
That is true.
As opposed to board-eligible.
That is true.
Because a lot of people are eligible, not so many certified.
There you go.
That's a true story. Yep.
And so, talk to us a little bit about HPV. And so, what is? I know this. This is a softball. doctor.
Okay, I can take it.
It's
Is-
not softball. It's important.
Well,
For-
okay, let me-
It's general information because the general public is being educated.
That's
today.
right. Okay, so let me ask you this: is HPV, human papillomavirus, is it a bacteria, is it a virus, or is it a parasite? What is it?
It is a virus.
It is a virus. And so why does that matter as opposed to, chlamydia and gonorrhea, which are bacteria or bacterium, and because it has some differences.
Well, it behaves differently, and because it is a virus, we're able to make a wonderful vaccine for it. So we do have vaccines out there called Gardasil that can help safeguard us against this virus. And so there's 100 strains of HPV. Some of them cause things like genital warts, and some of them cause precancer and cervical cancer, as well as anal cancer and oropharyngeal cancer.
Yeah, so it can cause a lot of things that are more than just uncomfortable.
Absolutely.
And so you had mentioned that there's a vaccine, and so since you brought it up, I think we should just jump into it.
Sure.
What I was thinking is that as opposed to bacteria, like if you talk about gonorrhea, chlamydia, trichomonas, and some of those things, is that those are treatable. And we can, if you get gonorrhea, we can treat you with antibiotics. Syphilis as well. We've talked about that on the other show. And I just want to emphasize again the importance of, if you have symptoms, if you feel like you're at risk, to get in and get checked. Because because oftentimes you may not have symptoms of these infections. But HPV is a virus. And so we can treat it, we can manage it, but it will not go away, like herpes. Correct?
Correct. However, in our younger populations, patients that are between 21 and 24, if they have pap smears that show HPV positive, sometimes they're able to clear that infection, and they won't have that high-risk strain of HPV any longer. So for the most part, that's absolutely correct. However, our younger patients can, because our immune system is stronger, can deal with this virus a little easier.
So let's go. I want to jump back to the vaccine, because you brought that up, and how important and successful this vaccine has already been shown to be.
Absolutely.
Can you talk? Who should we give this to? What age? And what does it do?
Yep. So the CDC is now recommending this to start this series at 11 to 12 years old, and we're suggesting that men and women are vaccinated. So if you have boys or girls at home, that's the recommendation. And it's a series of 3 vaccines. We used to have vaccines that only covered 4 strains, 6, 11, 16, and 18. And what those are the strains for genital warts and for the high-risk cervical cancer strains. However, now they've expanded that to cover 9 strains, which is great because it covers more of the high-risk strains. And so we definitely want to get these kids before they're sexually active to try to prevent them from acquiring these strains. However, if you are sexually active and you are older, then you're able to get it. And it's okay if you have one of the strains.
It'll still help.
It'll still help with the other ones. Absolutely.
And so I know that whenever people talk about vaccines, there's always the worry about safety. Can you talk a little bit about the safety of the human papillomavirus vaccination?
Absolutely. So there's a lot of misinformation out there about vaccinations, and I know both of you can talk to that as well, but there's a lot of fear with people with vaccinations. And there's a couple articles going around about Gardasil talking about kids having neurologic responses to it and things like that, and that has actually just not been found to be the case with this vaccine. It's very safe.
Well, I know I personally, I have an almost 14 and almost 13-year-old. We did have them vaccinated when they were 11 and 12. We went through we sat down and I think for a lot of people, it comes down to they think on some level that allowing this vaccine to be done is some sort of implicit permission that they're giving their kids to engage in any kind of sexual activity, or they think it comes with needing to have these complicated discussions with their kids that they think their kids aren't ready for. Our family, my husband happens to be a health professional, so we had all the information we needed up front. We had somebody who understood the medical studies, and we're reading the information, and we both spoke to the pediatrician about it, and the pediatrician recommended it. And we sat down and we had a very specific conversation with our kids. We said, we're talking about this vaccine, and this is why we want you to get it. This is what it does. This is what we hope it will do in the future. And this is what we are trying to help prevent. And they had questions.
Yep.
But we explained it very specifically. We said there were vaccines that we got you when you were babies, before you were ever able to sit up on your own. We did things to try to protect you for when you got older. This is the same thing. And then we even made a point, because, kids are at that age where you talk to them about something and then they go talk to their friends about something.
Mm-hmm.
And so we very specifically told our kids, 1, we're having this as a family discussion. This is what we've decided as a family. 2, no matter what we decide in terms of this vaccination, if you get it, this is not permission from Dad or I to go out and engage in behavior that we think is not appropriate for you right now. You're not ready for some of these things. You're not ready for that part of your life. This is really to protect you for when you get to that point in your life. That's way down the road. For now, we need to do it now, so it's earlier you're protected, the better off you are. And then we asked the kids if they had any questions, if they were afraid of anything, if they wanted to know anything, and we're really transparent and open about what the process would be like. And then we went through the process together. We actually even scheduled them to do it together, so they kind of had each other to lean on, in terms of, because it was, the shots were a little more painful than I think they anticipated. But they handled them.
Mm-hmm.
And I said, one of my kids gets allergy shots, so they thought they kind of knew what they were walking into, and it's a little different.
Mm-hmm.
But it made that transition for us a lot smoother, in terms of it wasn't fraud. It wasn't like this big, like, what are we going to do? We had the information. They had the information. We actually did come to a family decision on it. We did let their opinions be heard and what they wanted to be, a part of this conversation, because that was important to us, that if you're old enough to consent to something, or old enough to have to have a voice in it, you should be able to say, this is what I feel comfortable with. If they had both said they weren't comfortable right now, we would have probably tabled it and revisited it in a year. But they were both comfortable based on the conversation that we had. And that's what I keep telling people. Have the conversation.
Yeah.
Have a conversation with everybody. Talk to your doctor. Talk to your pediatrician. Ask questions. Get your questions actually answered, and not by Google. Google is not where you go to get this information. You go to trained professionals and ask the questions you need to ask.
Don't Google gynocasto.
There you go.
Right?
So close.
So I love what you're saying, because I think we all agree that it is important to talk about this stuff. And this is a whole other show. We got to do a show about how to talk to kids about sex, because there is no advantage to naivete.
Yeah, absolutely.
To ignorance when it comes. The world is too dangerous in terms of, we've been talking about sexually transmitted infections, and we're talking. I actually just brought up some information from the CDC, and we talked about this, and 17 million people are infected with the human papillomavirus every year. 17,000 women and almost 10,000 men are diagnosed with cancers every year related to HPV, and the vaccine could prevent many of these.
Absolutely.
So, and I always want to, when I talk to people about, surgery or anything, there's always a risk-benefit thing, right?
Mm-hmm.
And so, parents are obviously worried about the safety of any vaccine you give a child. But I will tell you this, that they have done probably 100 million of these vaccines, and let's just say tens of millions, and the number of people who've had significant side effects from these are extraordinarily low. Mm-hmm. Extraordinarily low. And when you balance that with the fact that 17,000 women every year are going to get a cancer related to HPV, and 10,000 men. And there's nothing that we do that is risk-free.
Mm-hmm.
Mm-hmm.
And I just think I try to normalize this thing for people, because everybody's frightened. You don't want something to happen that you played a part in terms of your kids. But
absolutely.
But these are dangerous cancers, and Dr. Stecker and I have both managed people with cervical cancer and genital cancer, and it's not a good way to live your life. It's not. And at least in the state of Minnesota, your chance that when you get in a car and you come to see your doctor or go to the grocery store or whatever, you have about a 1 in 14,000 chance every year of dying in a car accident. And yet we get in our car every day. Your chance of having some catastrophic event related to any vaccine is, I don't want to say zero, but it's extraordinarily low.
Mm-hmm.
And you have to go into it with your eyes open. So I'll stop talking now.
No, that was fine.
Good.
I would say
I couldn't help
anything.
myself. I just got going.
Yeah, I
Twila, you
know.
got me
I
going.
think it's important.
Push my button again.
I'm sorry, I didn't mean to.
Stop it.
But what you say is really, really true. And I, as a parent, the only message I really want to make sure that other parents hear if they're listening to this is be an advocate for your child first. There are always going to be things we're afraid of, things that we don't want to have happen to them, things we want to protect them from. But be an advocate for your child first. Don't go into a decision on whether to get this vaccination based on your discomfort and having to talk about sex, or your discomfort that your kid would ever engage in this activity, and that we shouldn't deal with it until they're old enough that we're talking about sex.
Yeah.
Because you're never going to get to a 100% comfort level on any of that. You just won't.
Yeah.
So the best thing you can do is to make sure you have the right information, you ask the right questions, and really in the forefront of your mind, will this protect my child? That's really should be the answer at the end of the day. You wouldn't get in your car and decide that today you're not going to use a seatbelt because you're not totally sure it will protect your child.
That is.
You're going to take the precaution. Take the precaution.
Absolutely.
So, what are the symptoms of HPV infection? Twila Dang. Dr. Kelly Christine Stecker.
I think Twila Dang should answer that one.
Oh no!
Sorry.
There's a reason there's no doctor in front of my name.
All right, you're off the hook.
All right.
Twila, you're off the hook.
For once.
So sometimes these patients come in to see us with genital warts first. Okay. So that's a visual change that we see. Sometimes people have no symptoms, and sometimes people will come in with bleeding after intercourse, bleeding between their cycles, and that can be a sign of something going on with their cervix. But often patients won't have any symptoms until we do their pap smear, and then we get an abnormal pap smear, and then that's the first they become aware of it.
That's right. And so the reason I wanted to ask you about that is it goes back to what we were trying to instruct or encourage our listeners, our patients to do in terms of protecting themselves, because you can't look at somebody and say, oh, they got HPV. I'm going to use a condom with them because they have HPV. And because you can't tell.
Absolutely.
And so you have to protect yourself. So you talk now. Okay, Stecker, are you ready for this?
Sure.
Can you get warts from a toad? Hello? Is anybody
Answer
else
no.
here?
I'm country. I'm gonna say yes.
Don't you remember that? There was the
country
old,
girls. Yeah,
there's a myth that you could get a wart from a toad.
Yeah, I remember that. I mean,
That's
mind you,
have you ever heard that?
That's.
I mean,
But I feel like that's the kind of thing your mom told you so that you wouldn't touch them.
exactly.
Then there was also the thing where you could get high if you licked a toad. It's like a certain type of
Oh,
toad.
I heard that
Get
actually.
what?
You get high from
that's
licking a
true.
toad. Yeah.
That's actually true.
Yeah.
Is that really true?
It is.
Yeah,
but it's got to be the right toad.
yeah, it's
you
like
can't just
it's
take
like
any toad.
Yeah, it's like some like tropical like area or something, and it's for you actually do that for medicinal purposes.
I think Heegaard's going to go check that out.
I'm just saying, on the GynoCast, we take an off ramp here, but the point I'm trying to make is that there are myths, and Dr. Stecker's going to give us a little quiz on them, but you cannot get a wart from a toad.
You cannot.
Really?
You cannot, because
I'm still telling my kids that because I don't want them.
Warts are caused by human papillomavirus, but not all viruses cause warts.
Correct.
Oh.
Now, before we get into more warts, psychoactive toad. This is actually what it's called.
It's a real thing.
Our psychoactive toads are toads
I would just
from
like
which
to,
psychoactive substances in the bufotoxin family can be derived.
I would just like to say I was
And
right
so
about that.
some people like to lick them.
Yep, I was right about that. Saw it on TV.
Rumors dating from the 1970s claim that groups of hippies, roving groups of hippies,
Roving groups of
including teenagers,
toad-licking
were licking the
hippies.
psychoactive toads to get high.
Roving groups of toad-licking
That
hippies.
does not surprise me one bit.
Indeed.
My Lord. Well, anyway, so don't lick toads.
Please don't do that.
You've heard it here.
And don't email the show if you do. It's not our fault.
Support for the GynoCast is provided by OBGYN West. OBGYN West provides the highest quality care from compassionate providers, including women's health issues from general sexual health to pregnancy care, childbirth, menopause, and beyond. Whether it's your teen's first annual exam, a new baby's on the way, or you're facing the special challenges of middle age, OBGYN West provides a wide array of services. Their doctors and PAs are trained in virtually every type of OBGYN service and procedure. OBGYN West provides exceptional care for women.
So, okay, the question I was going to ask to you, Dr. Stecker,
Yeah.
is, if you have a wart, can that wart cause cervical precancer?
It cannot. It's
It
different
cannot.
strains.
Right.
Yeah.
Oh.
That's a very common myth. So it's two, and like I said earlier, there's 100 strains of HPV out there. And so different strains do different things. And if you have strains that cause genital warts, that's not going to turn into vulvar cancer. It's not going to turn into cervical cancer.
Yeah, 'cause
Well, that's good.
certain types, I know we really care about, at least as far as we know at this point, we care about just a few of the different HPV viruses. Now, you have a quiz for us.
I do. So the first question, does a diagnosis of HPV mean someone cheated?
Twila.
No, but
You're
in my
you're a
irrational
skeptical
world, I'm usually swinging a bat before I ask the question. So.
That's why you're
Let's
on.
just-
Is that why
let's
you're on
just say-
husband number 4?
So let's just say the answer should be no, but if you're irrational like me, I understand if you think the answer is yes.
I would say no. And are we correct?
You are correct.
Okay. Do tell.
Well, sometimes this virus can hang out dormant for a number of years. So, for example, if you have a patient that comes in, long-standing relationship with her significant other, and all of a sudden has an abnormal pap smear, that could mean a number of things. It could mean that her immune system was compromised for some reason. It could mean that it finally decided to express itself. So it does not mean that someone is cheating
And so
necessarily.
yeah, it often we got to say
use your
that
common sense.
oftentimes it can.
It can.
But you got to, before you go on the attack, you have to realize that, most people have HPV and don't have any symptoms or don't recognize it. And
Yeah.
so, it is possible that to have been exposed when you were 17 years old and it just kind of reared its ugly head.
Okay, that makes sense. So put the bat down. That's what
Yep.
you're telling me.
For
Okay.
now. Yep.
Okay.
For now.
Okay. I can live with that.
All right. So an abnormal pap smear means cervical cancer. True or false?
No.
No.
No. Yep. And you are correct. So if you have an abnormal pap smear, there's a whole array of things it could mean. It does not mean cervical cancer necessarily. There's a whole spectrum of abnormal pap smears ranging from really minor changes that we just follow all the way up to precancer to cancer. And most of the patients that we see are falling in the line of very minimal changes that we can easily take care of.
That's right. I agree.
Okay, good.
I agree with the quizzer.
Yeah. Here's another one. If I have HPV, will I have recurrences?
Oh. I don't know. Yes?
No. Well,
Really?
I'm listening. I'm waiting to see what you say.
Yeah, I'm just guessing, right? Yeah, I'm just
trying to
guessing.
get-
Yeah.
Well, the answer I would say is no, not necessarily, because you can, as Dr. Stecker was saying, is that often most people get infected by HPV and then your immune system battles it, suppresses it, and it's possible to have it go away and never come back.
Really?
Would you agree with that, Doctor?
Okay. Okay.
Although we don't exactly know whether. Help me out with this. My understanding is that if you've been exposed to HPV, we don't know whether it's actually gone completely. Is that true?
Right. Yep. And so, let's say you're 30 years old and you have an abnormal pap smear and it's positive for HPV. You can maybe, when you're 48, come in and unfortunately have a positive pap smear for HPV then. They definitely can hang out and stay dormant. The other thing is warts. So if you have human papillomavirus associated warts and we treat it, whether we treat it with medication or whatever we treat it with, and they're gone, unfortunately you can have reoccurrence of those as well.
Yeah. Shoot.
Yes. But thankfully we have a lot of good treatments for those.
That's right.
So that is not it can be a very embarrassing thing, but it doesn't have to be something you have to live with.
Right.
All right, how about this? Older women do not need pap smears.
No, that's not true.
Define old.
Well,
Excuse you.
42 is that?
Excuse you.
Well, I think there's some suggestion that if a woman is
You don't need them as many years.
So we'll say over 65. How about that?
I've always that's what the recommendation is, right? Over 65. I always kind of think,
But isn't there a difference between like the pap smear and like the exam?
That is absolutely 100% a good point to make.
Okay.
Absolutely.
See, I
So
pay
we still
attention.
need to see you every year. However, if you have normal pap smears, and obviously it's a different game plan if you have abnormal ones, but if they're normal, you can stop at 65. But if you had abnormal pap smears, then you're on a whole nother train that your OBGYN will help you be on.
Oh.
All right,
All
so are
right.
you telling me, can you look me in the eye and tell me that you would not consider doing a pap smear on a 70-year-old woman who's met a new partner who's risky? Let's say she meets a filthy, vile partner. That you know he's filthy
That's
and vile.
very judgmental of you.
Yeah, like let's just say
nice
let's just say
gentleman.
Stella decided to get her groove back, and she comes in with like a 30-year-old, and she's like,
Well, good for her.
So,
Yeah.
okay, let me ask you this. Good point, Twila. So Stella comes in. She's 75 years old, and she looks great. And she's vibrant. And she's energetic, and she's met this new 35-year-old guy.
You do realize
who's
you're
got-
talking about my future life here.
Yeah, she's got, and
There you
this
go.
guy, for some reason, is clapping his penis all the time, right?
No,
He's got
Doing this.
refer for those of you who don't know what we're talking about. Please refer to the
Yeah.
other episode.
Yeah,
where
we
we
had-
talked
and
about
it's
We have a-
traumatizing.
Yeah, we
just
have a
like
great
it is today.
STD episode.
So,
of the
let's. I'm talking tongue in cheek here a little bit, but let's say, and seriously, so this
Yeah.
guy's got a dripping penis, right?
Oh boy!
And she comes in with a new vaginal discharge, and she's got chlamydia. Are you saying you're not going to do a pap smear on this woman?
I'm not.
Why?
The reason is cervical cancer is such a slow-growing cancer, and the ASCCP guidelines, American Cancer Society, right now are saying don't do it. We still want to do annuals now. That doesn't mean that I won't look at it and I won't do a pap smear if something seems abnormal. I certainly will biopsy something if I'm doing an annual exam and looking at the cervix and there's something suspicious. However, that's the importance of annual exams as well. Coming in and having a pelvic exam. And the guidelines for pap smears have changed so dramatically in the last few years. We used to do pap smears at age 16. We used to do pap smears when you were first sexually active. Now we do not do pap smears until 21. And between 21 and 30, we do pap smears differently than between 30 and 65. And between 30 and 65, we do them every 5 years with human papillomavirus testing. And because we have that element of the HPV testing, that's what's allowed us to lengthen the interval.
Yeah, we understand the disease process.
Right, yeah. So because we understand more, then we can avoid some of the over-treatment as well.
All right, I'm just going to tell you.
Okay.
I'm not disagreeing with you because you're stating the standard.
Mm-hmm.
I would, but I'm just telling you that if I had a 75-year-old woman who came in with chlamydia, with this knuckle-dragging, vile
Okay, why
creature.
Why can't he just be a nice young man?
I mean, he just might like older girls. What's wrong with that?
Well, or he might be Mr. Wonderful down, in 17A, just down seriously.
I mean-
These senior retirement places have become the new.
They're the hookup spot.
They are the hookup spot.
Yeah, they are.
Stecker, you
It's
don't.
true.
No, I believe
You're
you.
paying
I've
for the
read
hookup
it.
spot.
I understand.
Yeah, they are. Yeah.
My
Stella is-
grandma's in one. I would prefer not to think about this. She's pretty vibrant. I don't know.
All right, so I'm just saying that I think there are protocols.
just
and
as a sidebar, I had already decided we had like a girlfriend discussion recently where I said my greatest wish is to live long enough for my children to have an awkward mom have sex safe conversation with me as an older woman, and I'm going to pretend like I don't get it when they try to talk to me
Yes.
individually, so that they have to sit down as a group and be awkward together. I feel like that is
we
the
all have
hallmark.
to have aspirations.
Yeah,
That's great.
I feel like my kids have put me through enough that there's going to be a couple of points in this life where I'm going to really sit back and enjoy it. That is going to be one I enjoy, really and truly.
Do you think we're ever going to get your mom on the GynoCast?
No, and I even asked her, and she said an expletive, and that was so that should tell you the answer's going to be no.
My goodness.
I told you I'm the tame version of my mom, so just wait. If we keep
We
doing this,
need to get her on the show right away.
Yeah,
then.
if we keep doing this show and I get to a certain age, it's going to get real fun around here. That's
We
just
can look forward to that.
Yeah.
So the difference. So the main things. So
I'm sorry. I'm
bring
sorry.
us
You're
back on
You're being a
track.
very good doctor. Go ahead.
Thank you.
Thank you.
So the main things HPV causes is warts,
Mm-hmm.
cervical precancer, and cervical cancer.
Mm-hmm.
But also we have found that there is implications in terms of throat cancer
Mm-hmm.
and anal cancer.
Mm-hmm.
And so how do we screen for that or look for that?
Mm-hmm. So a lot of different options for that. So actually anal pap smears have kind of become a little bit more in vogue lately. And for my patients who...
In vogue?
Well, I mean, they're more the hot topic, okay, so to speak.
Don't look at me.
It sounds like, the new Ferragamo shoes. Have you seen those new Ferragamo shoes? And I had an anal pap smear last week.
Well... No, it's important stuff.
Okay, listen,
so
I'm not gonna say anything except I went to a concert last night with a bunch of girl women, and that was
Wait.
fairly
Was that
close.
the New Kids on the Block concert?
Yes, it was.
I was there as well.
Oh my gosh. Okay, we'll talk off. We won't derail the show, but we're going to talk about this after we're done.
I would love to derail it.
Okay. But I will say this, because in these kinds of conversations we're talking about, transmitted diseases and sexual activity, there was a lot of estrogen in that concert last night.
It was serious.
A lot
It
of
was-
rubbing.
It was
going on,
very
probably true.
serious.
I was actually thinking the majority of the time that those young men, not really as young anymore as they
yeah,
once
they're
were.
not really. Yeah, they're not really.
How well kept though.
Yeah, maintained.
Very well maintained. Like fine wine, if you will.
Oh, okay.
Anyway,
Not disagreeing.
they very likely have a whole concoction of STIs. Is kind of what I was thinking.
Oh yeah, I mean, listen, they probably got like 4 of them while they were on the floor.
I mean,
last
there's
night.
like how many? There's how many? Yes. Oh, I witnessed it. But there's how many thousands of women that would throw themselves at these 5
Oh
people?
yeah, easily.
And I honestly be one of them probably. I'm not going to sugarcoat that.
If you want more information on Dr. Stecker, please do go to our website at obgynwest.net.
Thank you so much.
Listen, it's nice to know our doctors are multifaceted
That's right.
people.
We need
you
to
go.
She's
humanize
not
it.
just a stuffy doctor. She has a fine appreciation for a boy band like I do.
That's
Nothing wrong
exactly
with
it.
that.
There is nothing wrong
Nothing
with it.
wrong with
Nothing
that.
wrong with that.
No.
Since I was 11. I mean, come on.
Thank you. I had.
Who are the members of...
Oh, boy. Jonathan and Jordan Knight.
Yeah, they're brothers.
Okay, they're brothers. Joey McIntyre, who was my man.
Was that your favorite?
That was my guy.
Okay.
Okay. And then there's Donnie Wahlberg and Danny
Wood.
Wood.
Is that Mark Wahlberg?
Yes,
Mark
that's his
Wahlberg's
older
brother.
Yeah.
Yes.
Marky Mark?
Yeah.
Yes. So Donnie's not quite as good looking as Mark, but
But he seems like
he's
more
well
fun.
maintained though.
Listen,
He's more fun.
I'm speaking of attraction and rubbings of parts, which is what happens, right? A great rubbing of parts.
Okay.
Which is what it comes
we're
from.
not breaking out the Scottish accent.
I'm just
It's not happening.
I'm just telling you,
It
I
just
don't
did.
find Mark Wahlberg attractive at all.
That's okay, me neither.
He seems like
Really?
he looks
No.
like a Cro-Magnon man to me. And,
no thanks.
For
and
some
so-
people, it does it.
So for you to say that Donnie is not as good looking as Mark,
He's not.
He's not,
But
though.
they don't do anything. Neither of them ever did anything.
so I'm going to ask you again. So if your 75-year-old grandmother comes to you and says, "I've got," okay,
She's
let's say
sleeping with Danny.
I'm not. Yeah,
Let's just
she's
say
dating.
Danny is really gross.
She's
I'm
dating.
sure he. Yes.
Okay,
She introduces you to her new boyfriend, Danny Wahlberg. Knuckle dragging, penile dripping. You're not
I
going
would
to do.
say congratulations.
Because at least we know he's got the money to pay for treatments.
All right, so Dr. Stecker and I are going to have to agree to disagree about our pap smears of
But you know
more
what, though?
senior women's.
It's nice to know that even, sort of in the understood medical community that you guys, you're both well trained, you're both very proficient doctors, but that you have differences. You can have differences of opinion or differences in tactic on how you would approach things, but in a really respectful way. You know, so
Absolutely.
it's. I mean, that's
All respect
that's,
and professionalism.
That's a good thing to know. I mean, I think, and, as a patient, because I'm always a patient, never diagnosing anything. I it's nice to know that you guys have different points of view and how you. I mean, it's like you tell us all the time that if it's something serious, get a second opinion because the approach might be different, or the way that they approach treatment might be different.
We talk to each other, and we all do. And if we have something that's a little unusual, and we talk to each other and ask their opinions.
Well, and we talk to the patient, so that's the other thing. I tell the patient the guidelines, and from there we can deviate. I'm perfectly comfortable making a plan that both of us are comfortable with. And what's the harm in doing an extra pap smear? So, obviously in the younger population, we don't do them because we don't want to overtreat. However, if you're making a plan with a patient, you're both comfortable doing it, then there's no reason that you can't deviate off of that to make everyone happy with the plan.
Yeah. So is there any way to, and so what is and you're not going to do anal pap smears on everybody.
No.
Right? So I know, and how do you, I have not done one. I don't think I haven't done one recently, but who would you do an anal pap smear?
My patients who've had cervical cancer, I do anal pap smears on, and I've actually caught a couple anal cancers that way.
Okay, and the pap smear, and I know most people know what a pap smear is, but we use a little brush and we use that to sample cells from the cervix. But you also just put that brush against the anal opening and sample cells like that.
Just don't use gel. You put a little water on it, and basically the same, very similar technique.
It's not painful.
No.
I'm not saying it's comfortable. But
no,
it's
I mean it's just
you wouldn't pull off the road for an
I'm
anal
assuming
pap
it just
smear.
feels. I'm assuming it feels weird, like a pap smear. It feels weird.
Yeah, absolutely. However, there's not a speculum there.
Oh,
so
ding ding,
so,
you win.
Actually, it probably is a little bit more comfortable, honestly.
Yeah. Now, how about isn't it Mike? Who's the movie star who had the throat cancer?
Oh, Michael Douglas.
Yeah, and so but that is HPV related, and so is there? I don't know.
But he literally, I mean, so is that actually accurate? I mean, he essentially blamed that on his wife. He blamed it on cunnilingus. He said so.
That's his wife's
name?
No, but that's what he was doing. He said.
What did unusual?
He actually said that.
Oh, wow.
I'm blaming this on my wife, cunnilingus.
Wow.
Okay. No.
Wow.
But I remember thinking, because even before, like that happened well before we started doing the show together, that he said that publicly in some magazine that's what caused it, and it was like,
hello, he's been having sex since before she was born.
Guy.
Yeah,
so,
and it was like, I mean, but everybody was up in arms about, because it led to a whole sort of think piece culture of, how something hits the news, and then you hit a whole bunch of think pieces from journalists talking about, what's appropriate or not appropriate in it, and there was like a whole, sort of think piece set of.
Was he
stories.
blaming it on his current wife?
Yeah, Catherine Zeta-Jones.
How would you feel?
I think he was blaming it on his previous wife.
Oh, I thought it was.
That's okay.
It was that okay?
That's fine.
We don't know her.
That's terrible.
As long as it's not Catherine.
Yeah, but just the idea of that.
That is the worst. That is the most. I will just say that is the most ungentlemanly thing.
First of all,
terrible.
that's the first thing I thought was you're a jerk for saying that.
Yeah, absolutely.
In any measure, and then it created a whole set of discussion points of should you just not be performing oral sex on women, and it was like, okay, hold on, why punish all of us because he doesn't know what he's doing,
and then
that's
we're
wrong.
not having oral sex on men then either, because
thank you.
It's same deal. You
Goose
get
and gander
HPV
here. Thank
oral
you.
pharyngeal cancer, equal opportunity.
That's
right.
No, thank you.
Yeah, they get it from what goes around comes around.
Exactly.
Yeah. So I mean, but I think people had always thought that was some sort of urban myth that actually could happen that way.
Well, so again, the thing is that how do you prevent against? Well, and really, you got to convince these guys to wear condoms.
Yeah.
You
Yes.
got to.
Yes.
Because
Just learn a couple of tricks.
And get your vaccine.
Yeah.
how are we going to convince women to get these men to wear?
I mean,
condoms?
learn a couple of tricks. I had some very good friends in
Twila.
college.
Oh.
I had some
tell the
very
tricks.
good. I had some very good friends in college who
Should I grab us
were.
some coffee?
I mean, you might want to take out a notepad.
I think some wine might be better. I don't know.
They had the tricks for putting on the condoms in a way that was creative, so that they weren't arguing because they were getting something out of that process.
All right, just come on, just tell us what you're talking
They
about.
they were able to put on the condom with their mouths during oral sex beforehand, so
That seems very coordinated.
yeah, it was. I'm not gonna say I was successful at it. Nope. but
Without the
it
guy
worked
knowing?
for them. Well, no, I mean he would know about it because he's getting something out of it. See what I mean?
Yeah.
Yeah.
All right. Well, that's.
Yeah. So I mean, like I said, I had some very crafty friends.
Stay tuned
It's
for more
almost like
information.
Etsy. I don't know.
We're gonna have to.
So I mean,
Talk about that
worst
more.
case scenario, you maybe have to learn a couple of tricks.
However, then there's that whole it's not wrapped up oropharyngeal cancer HPV stuff.
True.
And
See, and
also there's
nobody's,
that.
and the thing is, I remember when I went to college in the early mid 90s, and we had the people come on campus and they talked to us about dental dams, and you could get free dental dams.
Yeah.
Nobody's
Nobody
using
uses-
that.
What is it down? Do you even know
Who's
what
even used them?
It's
a
a little
plastic-
rectangular piece of latex that you're supposed to place over the parts before you do anything. And I'm
I
like,
just see these people like
I'm like,
asphyxiating.
at this point,
this guy
you'd
turning
be,
blue.
I'm like,
What happened to him?
I wish there was a camera in here for that. That facial expression.
We've got another dental dam.
yeah, I mean, I remember thinking it being the most ridiculous thing I had ever heard of as like a 19-year-old. Like,
And we tell
nobody's
every
doing
child in the world not to put a plastic bag over their head.
right,
Everyone.
and then you tell them to put it over their genitals and go for town. Nope, it's not happening. It's not happening.
That's coordinated.
It
Get your
just seems
vaccine.
it's
Get
like
your
yeah,
vaccine.
yeah, really and truly get your vaccine. I would, and I'll be honest because I told you I was raised in the South. Do not break out the accent, but I know a whole
He's got a whole variety of
yes,
Back
he
in
does.
my
Stop
day.
doing it. There is a whole category of women that I know personally who reserve certain sexual activities for marriage. Like there's only so far you can get with them, and you have to make a lifelong commitment before you get the other things.
Well,
And by then, and at
I
that
think
point,
that's very common.
yeah, and at that point, you start getting, you're getting your testing done. You're getting, kind of things taken care of. And I remember one girl that we were very close to, and they wound up finding out he had an STD because they were getting tested for stuff before their honeymoon because they were leaving the country and they were going to get
Boy, that
like
must have been a nice
vaccination. Yeah, that was
plane
awkward.
ride down
It was
to
awkward.
Bermuda.
It was awkward. But
Nice.
I mean,
Yes.
but they found out, which is you needed
What
to find
was
this
it?
out.
What was the sexual
I forgot what it was.
transmitted
I forgot what it was. I just remember her being appalled, and I was
Well,
like,
but
"Yeah, I would
maybe
be."
she
Well, now
made
you're
the
married.
But
Yeah.
maybe she made the judgment.
Well, no,
that-
they were still fiancés at that point.
Oh.
They hadn't
Did
hadn't
she
married
bail
yet.
out?
No, she didn't bail out.
But I'm just saying that, as Dr. Stecker was saying, you can't, just because you get HPV does not mean
That it's a deal breaker,
yeah.
right?
Absolutely.
Right, but it was
Or
a
herpes. It's the same thing with herpes.
but it was a
Yes.
conversation. Yeah.
Oh, I'm
I
sure it was
bet
a
you it was
conversation.
an awkward conversation.
yeah, probably. And then we didn't get all the details, but we knew enough to be like, "Oh, girl, this is gonna be an interesting reception." So we were like, "Okay," but
Oh, my
Wow.
Lord.
yeah. But I mean,
That's
I agree
good.
with you. Get tested, use condoms,
Well, see,
take
that-
precautions.
That brings up another important point, which is, you are walking out into basically the jungle of human nature, right? And so before you start dating, before you start having intimate interactions with people, we recommend that you get tested and you expect your partner to be tested. Like, pull out the card, right?
I don't think there's anything wrong with that. I will say this: a lot of my gay friends, that's common. That's become, over this last 30 years, given that we kind of grew up and were considered the HIV/AIDS generation. That's fairly common practice for a lot of my gay friends. That if they're in a new relationship, before they get to the next level, it's like, okay, well, you want to go get tested together, or you have your test results, I have my test results, and how often, like, when's the last time you got? Like, they're much more transparent about it
Yeah.
than my straight friends were.
Yeah, I mean, I don't know any straight people who do that.
Yeah.
And we probably should.
And yeah, and I'll
Probably
be
should.
perfectly honest. I wasn't one to think about, testing and things like that until my husband got far enough in his career that it became a course of, as a health professional, he was being tested for everything all the time. So then it was like, oh, if you're getting tested, I'm getting tested. And then it was like, okay, let's have a discussion here, because if it comes back and it's not clean, I mean, we've been together for like a hot minute now. There's going to be a problem, but that wasn't even something we really thought
Don't you
about.
wish you had the GynoCast you'd listen to so you would know not to make snap judgments?
No, he needed to know early on that I was crazy, and it was established.
Well, yeah,
It's okay.
and then he's mentally prepared, and then he can
Right. And
commit to it or not.
Yeah, he knows the bat sits next to my bed for a reason, so it's fine.
Dear Lord.
It's okay.
So to recap, I'm gonna try to recap this.
Okay,
'cause
go for it.
I actually I'm enjoying this so much we could go on for like an hour talking about.
We'll do a follow-up. We'll
but
do a
so
follow-up.
with HPV is a virus. It's actually viruses.
Viruses.
100, as Dr. Stecker said, almost 100, but only a few of them at this point we realize have clinical bearing. There are some that cause warts. The ones that cause warts do not cause precancer or cancer. And the ones that cause cancer are not the ones that cause warts, correct?
Correct.
It is a virus, so most of the time, if you are infected with human papillomavirus, your immune system will knock it out. Correct. Hopefully. And so,
however, the strains that are of clinical significance can come and go. So those strains for genital warts, even if we treat your genital warts, can come back. So it does stay dormant in those cells, unfortunately.
And for people with cervical precancer and hopefully, God forbid, cancer, we have ways to screen them, to follow them, and hopefully ensure that it doesn't come back or that there's no progression. So in terms of prevention, we talked about the vaccine and the importance of getting that vaccine for both boys and girls when they're young, before they're sexually active.
Yes.
And we talked about the health, the safety of the vaccine and the efficacy. And condoms, right? And there's not a whole lot else we can do besides wearing snowmobile suits and wrapping ourselves up in plastic wrap.
And we're not.
If you're not going to, that's kind of the option. When you touch somebody else, you run the risk of being exposed to what they've got, and most of us are willing to take that risk as long as it's
all right,
modifiable,
controllable. Well, best you can anyway.
True.
Wear condoms.
Just listen. Use your common sense. Wear condoms. Be communicative with your partner. Be honest with your partner. Be smart.
And because I will tell you this, there's not one man in the world who, if given the option to wear a condom or not, is going to say, I'd rather wear a condom. Well, most of the time. And you don't look like you agree with me.
Oh, no. I'm with you.
No, she's thinking NBA players always wear them.
Okay. I would say, let me modify that. Most men, if given the option, would probably choose not to wear a condom.
Right.
Okay.
And so, but if given the option, if you have to choose between having sex with a condom or not having sex with a condom, wait.
Yeah.
Or having sex at all.
Well, yeah.
No sex. Sex with a condom.
Okay. Or no sex with a condom. You can go over there with your condom, and I'm not having sex with you.
Yeah. Thanks for bringing that over. It's not happening.
That's an option. So, let me restate that: sex with a condom or no sex at all.
There you go.
Condom or not. And, they're gonna choose to wear the condom.
Yeah.
And the same thing with oral sex. If you say, I'm not going to perform oral sex on you unless you have a condom on, or you're not getting you're not having oral sex at all. Right?
We would hope that would be the case.
In theory.
Yeah, in theory. In practice, be prepared not to do it. How about that?
It's like a good sales pitch. You got to be willing to walk away, right?
That's
Twila?
exactly it.
You got to be willing.
Amen. I'm all for that.
You have been listening to the GynoCast. Thank you so much. Dr. Stecker, thank you for coming back.
Thank you for coming in. Don't forget, you guys, if you have emails, if you want to comment on today's show, if you have questions, comments for us, go to the Facebook page. Go to Facebook, type in the GynoCast.
The GynoCast.
You should already be a member, but if you're not, click on the little button that says you'd like to be a member. We'll vet you very, very quickly. You'll be a part of a group. We have dynamic conversations. We talk about difficult topics in a very respectful way, and we have a very great mature, freewheeling community of people who are very supportive of one another, and we love it. We also referenced another podcast that we did earlier. We talked more about the scope of the most recognizable STDs. That podcast, as well as this one, can be found at our website. Go to matriarchdm.com, and you can get previous episodes. You can find out more information. You get the syllabus. Whenever we have an episode, we'll have sort of a little syllabus of links and things related to the topic that might be helpful to you as well. Okay. So,
can I ask you a question?
Yeah.
Does matriarch have an H in it? I don't remember.
Yes.
How do you spell it?
MATRIARCH. Matriarch, and then put in the DM afterwards.com.
What does DM stand for?
Digital media.
Oh, okay.
But it was a very long thing to ask y'all to type all the time, so we shortened that up.
If I was searching, I wouldn't have put the H in there.
Oh, well, you'll get used to it over time. And we'll always have links. We'll have a tab and a link on the GynoCast page so that you're able to get directly to the website without doing a lot of fumbling around. We're going to make it one-stop shopping for you as best as we can.
That's right.
So thank you so much for listening.
See you soon.